There's a quiet fear that creeps in for a lot of people as retirement gets closer. It doesn't always announce itself loudly. Sometimes it shows up as a simple question: what happens to my health coverage when I stop working? And for millions of people right now, that question isn't hypothetical, it's real. It's sitting there, unanswered, quietly nudging its way into every retirement conversation they try to have. Because here's the truth nobody wants to say out loud: retiring without healthcare coverage isn't rare anymore. It's becoming one of the most common financial pressure points in modern retirement. Maybe you're 62 and thinking about stepping away from work, but Medicare doesn't kick in until 65. Maybe your job was your only source of insurance. Maybe your spouse was covering you, and now that's changing. Whatever brought you here, I want you to take a breath. Because by the end of this video, you're going to understand 5 things that will completely shift how you think about this problem. Let me just say, if this content resonates with you, the subscribe button is right there. I never waste my viewers' time. Now let me tell you about 2 people I know. Their names are Barbara and Susan. Both retired last year. Both worked hard their whole lives, but their stories couldn't be more different. Barbara is 63. She spent 34 years as a nurse. She saved about $310,000 for retirement, owns a modest home outright, and lives in a small town in Ohio. She retired 2 years before Medicare would kick in. Susan is also 63. She was a corporate accountant. She saved over $890,000, drives a nicer car, lives in a larger house in the suburbs. On paper, Susan looks like she's winning by a mile. But here's what most people miss. Barbara sleeps peacefully at night. Susan doesn't. And the reason has nothing to do with how much money either of them saved. The difference is how they approached the healthcare gap between early retirement and Medicare. One planned for it with clarity. The other assumed her savings would just absorb whatever came at her. Let that sink in for a second, because it changes everything about how we should be thinking about this topic. So let me walk you through the 5 things you actually need to know if you're retiring without healthcare coverage. Not scary things, not overwhelming things, just clear, practical truths that put you back in control. The first thing you need to understand is what healthcare actually costs when you're paying for it yourself. And I want you to picture something before I give you any numbers. Think of it this way. Your income floor is like the foundation of your house. Strong, underground, invisible, but holding everything up. Your savings? That's more like the furniture. Beautiful, useful, comforting, but not what's holding the roof up. When you retire without healthcare coverage, you're essentially exposing your foundation to weather it wasn't designed for. And the storms in this case are medical costs, insurance premiums, and unexpected bills. For a single person retiring at 62, the average monthly cost of a private health insurance plan can run anywhere from $600 to over $1,200 a month, depending on where you live and what level of coverage you choose. For a couple, that number can easily double. Now, before that number scares you, remember this: you're not behind. In fact, you may already be standing on one of the strongest financial foundations available today. You just need to see the numbers clearly so you can make real decisions. Here's what most people do wrong. They estimate healthcare at maybe $300 or $400 a month. Then reality hits, and suddenly their entire retirement budget feels wrong. The real number for most early retirees is closer to $700 to $1,000 per person per month when you factor in premiums, deductibles, copays, and prescriptions. That's not meant to alarm you. It's meant to inform you. Because once you know the real number, you can plan for it. You can build around it. You can stop guessing and start deciding. The second thing you need to know is that the marketplace, the Affordable Care Act marketplace, is not just for low-income people. This is one of the biggest misconceptions I hear over and over. A lot of retirees walk away from the marketplace without even looking, assuming they make too much or have too many assets. But here's the quiet truth. The marketplace uses your modified adjusted gross income, not your total net worth. That means if you're living off savings and your actual taxable income in retirement is modest, you might qualify for significant subsidies, even if you have $500,000 sitting in an account, even if your home is paid off. Think of it this way. Imagine walking onto a car lot. Every vehicle has a sticker price. Bold, official, intimidating. It looks final, non-negotiable. But nobody pays the sticker. Healthcare and retirement works the same way. That $1,200 a month premium you saw, that's the sticker. But depending on your income, your actual cost could be $400, $300, or even less. Some people pay almost nothing. The problem is, most people never check. They see the sticker, they panic, and they either delay retirement or drain their savings unnecessarily. Here's a question. If you had to choose between more money or more certainty, which would it be? Keep that in your head as we go, because certainty is exactly what understanding the marketplace can give you. Now, this doesn't mean the marketplace is perfect. It has trade-offs. Networks can be smaller. Some plans have higher deductibles. But when you weigh those trade-offs against paying full private insurance rates, the math often changes dramatically. The point is, don't rule it out until you've actually run your numbers. Get a real quote based on your projected retirement income. You might be surprised at how affordable coverage becomes. The third thing you need to know is about COBRA. And this one is tricky because COBRA is often the first thing people think about when they leave a job. COBRA lets you keep your former employer's health insurance for up to 18 months after you leave. It sounds like a lifeline, and in some cases it is, but it comes with a hidden cost. When you were working, your employer was probably paying 70 or 80% of your premium. You only saw a small chunk on your paycheck. With COBRA, you now pay the entire premium yourself, plus a 2% administrative fee. That means the same coverage that used to cost you $150 a month might suddenly cost $900 or $1,000. Same insurance card, same doctors, just a completely different price tag. COBRA can still make sense in certain situations. If you're only a few months away from Medicare, if you're in the middle of expensive treatment, if you don't want to switch providers mid-year, it's a bridge, a short one, but sometimes a necessary one. But treating COBRA as your long-term plan is where people get burned. It's not designed for that. It runs out at 18 months, and by then, you may have burned through cash you'll wish you still had. Before we continue, if you haven't hit that subscribe button yet, this would be a really good time to do it. Let me ask you something personal. Have you ever avoided opening your retirement statements because you were afraid of what you'd see? A lot of people do the same thing with healthcare quotes. They avoid looking because they're scared of the number. But avoidance is the most expensive strategy of all, because while you're avoiding, the clock keeps ticking, premiums keep rising, options keep narrowing. The fourth thing you need to know is about the gap years, that painful window between early retirement and Medicare eligibility at 65. This is where most people either overspend or underestimate. Some things in life are heavy but invisible, like carrying a backpack all day. You get used to it, but it never goes away. That's what an unplanned healthcare gap feels like in retirement. It just sits on your shoulders, month after month. If you retire at 62, you have 3 years before Medicare. If you retire at 65 years, if you retire at 55, 10 years. And every one of those years, you're responsible for your own coverage. For most people, this gap is where the largest single retirement expense lives, outside of housing. And yet, it's the one people budget for the least. They pour energy into calculating investment returns and Social Security timing, but they gloss right over the healthcare bridge. Here's what a smart approach looks like. First, calculate your gap years, how many years you'll need private coverage before Medicare. Then multiply that by a realistic annual cost, somewhere between $8,000 and $15,000 per person per year. For a couple retiring at 62, that could mean anywhere from $50,000 to $90,000 in healthcare costs before Medicare even begins. That's a real number. That's a number that needs a line item in your retirement plan. And here's the emotional part most people don't talk about. Some retirees, when they see that number, feel defeated. They think, well, maybe I can't retire yet. Maybe I need to keep working. But that's not always the answer either. It's not about who has more saved. It's about who has more certainty. And certainty comes from knowing your numbers, not fearing them, because there are strategies. You can time your income to qualify for marketplace subsidies. You can use a health savings account if you have one. You can consider a health share ministry if it fits your situation. You can even look at part-time work that offers benefits. The gap years don't have to sink your retirement, but they will if you pretend they don't exist. The fifth thing you need to know might be the most important one. It's about how healthcare risk quietly changes your entire retirement plan, not just your budget, your whole approach. Because inflation is like an ice cube in the sun. It doesn't melt all at once. It creeps, it nudges, it slowly raises the cost of everything around you. Your groceries, your insurance, your healthcare. And healthcare inflation has historically outpaced general inflation by 2 to 3 times. That means the $900 premium you're paying today might be $1,200 in 5 years. The $6,000 deductible might be $8,500. And this isn't guessing. This is decades of real data. So when you plan for healthcare and retirement, you can't just plan for today's costs. You have to plan for tomorrow's costs too. And that changes how much cushion you need, how you invest, even how you time your withdrawals. Let me ask you, have you ever calculated what your healthcare costs might actually be in 10 years? Most people never do. They plan for today and hope tomorrow figures itself out. But hope isn't a plan. Clarity is. And clarity comes from doing the math even when the math feels uncomfortable. Here's the good news, though. Once you know the numbers, you can build around them. You can create what I call a healthcare buffer, a separate mental bucket, or even a separate account dedicated only to covering health costs for the gap years. Some people set aside $50,000 in a conservative account and treat it as their healthcare bridge fund. Others use a Roth conversion strategy to keep taxable income low during those gap years, maximizing marketplace subsidies. Others use part-time consulting to cover premiums while their main savings stay intact. There's no single right answer, but there's always a wrong one, pretending it isn't a real expense. Because when you don't plan for healthcare, healthcare plans for you, and it doesn't ask nicely. Numbers matter, but how you feel about those numbers, that matters just as much. And when you feel unprepared for healthcare, that feeling seeps into every other financial decision. You spend less than you should. You worry more than you need to. You second-guess retirement itself. Now I want to bring this back to Barbara and Susan for a moment. Remember them? The nurse with $310,000 and the accountant with $890,000. Barbara sat down before she retired and mapped out her healthcare gap. She was 63, needing coverage until 65. She calculated her marketplace subsidy based on her projected income. Her monthly premium ended up being $180 after subsidies. She budgeted $500 a month to cover premiums, out-of-pocket costs, and prescriptions. She knew exactly what to expect. No surprises. No panic when the mailbox brought a medical bill. She built her retirement around real numbers, not hoped-for numbers. Susan, on the other hand, assumed her larger nest egg would just absorb whatever came at her. She didn't check the marketplace because she thought she made too much. She went with a private plan at $1,150 a month. She never budgeted for deductibles. Her savings started leaking, quietly, month after month. By the end of year one, Susan had spent over $22,000 on healthcare. Barbara had spent about $8,000. Same age, same health, same country, but wildly different outcomes. Because one had a plan and the other had assumptions. You may already have what people with millions are searching for, because clarity is what everyone chases in retirement. Not more money, not more assets, just clarity. And healthcare is one of the biggest sources of unclarity for most retirees. Here's a question. If you found out today that you're actually on track, how would that change your week? Because a lot of people are more on track than they realize. They just haven't done the math yet. Now let me give you 5 practical steps you can take right now, no matter where you are in your journey. These aren't complicated. They just require a little bit of your time. Step 1, calculate your gap years. Write down the age you want to retire, subtract that from 65, and that's your gap. Even if you're already retired, count the years remaining until Medicare kicks in. That number is your target. Step 2, get an actual marketplace quote based on your projected retirement income, not your current income, your future income, because that's what determines your subsidy. This one step alone has saved people tens of thousands of dollars. Step 3, build a healthcare bridge fund. Even if it's just a separate line item in your spreadsheet, name it. Give it a purpose. Fund it a little at a time if you have to. The point is to stop treating healthcare as an invisible expense. Step 4, review your income strategy. If you can control how much income shows up on your tax return during gap years, you can control your marketplace subsidy. This might mean drawing from savings instead of a 401k. It might mean delaying Social Security. It might mean converting some retirement accounts strategically. Step 5, talk to a professional who understands healthcare planning specifically, not just any financial advisor. Someone who has helped people navigate the pre-Medicare years. This one conversation could reshape everything. Now, none of these steps require a huge income. They don't require a $1 million portfolio. They just require attention. And attention, in this case, pays higher dividends than almost any investment you'll ever make. You don't need perfection to have a successful retirement. You need clarity. You need honesty with yourself about the numbers. And you need a willingness to face healthcare as a real expense, not a hoped-away one. Let me ask you something else. Have you ever noticed that the retirees who seem the most peaceful aren't the ones with the biggest bank accounts? They're the ones who know what to expect. They're the ones who don't get blindsided. That kind of peace doesn't come from having more. It comes from understanding more. Now, I want to talk about something people don't bring up nearly enough. Survivor planning around healthcare. Because if you're married, healthcare planning isn't just about you, it's about your spouse too. If one spouse has employer coverage and retires early, the other spouse might lose insurance overnight. If one spouse passes away before Medicare, the other might suddenly be paying full private rates alone. These aren't rare scenarios, they happen every day. Here's a question for the married folks. Have you and your spouse ever actually talked about what happens to health coverage if one of you leaves the workforce first, or if one of you passes before 65? Most couples haven't. And that silence has a cost. Talk about it, even if it's uncomfortable, even if it feels early, because these conversations become much harder when they're happening in the middle of a crisis. And this is where the pension value and Social Security timing come back into the picture. Because your income strategy directly affects your healthcare strategy. They're not separate, they're deeply connected. If you take Social Security at 62, you have more monthly income, but you might miss out on marketplace subsidies. If you delay Social Security to 67 or 70, your income during gap years is lower and your subsidies are higher. See how those choices ripple? This is why retirement planning can't be broken into isolated pieces. Healthcare, income, taxes, Social Security, they all pull on each other. Pull one, the others move. Think of your benefit like a faucet. Behind that faucet is a pipe, one you've been filling your entire working life. Every paycheck, every tax contribution, it all builds pressure in that pipe. And how you turn that faucet, when, how fast, how slowly, determines everything downstream, including your healthcare costs. If you turn the Social Security faucet on too early, more income might flow, but so does a higher tax bill and a lower marketplace subsidy. If you turn it on later, less income flows now, but you might unlock thousands in healthcare savings. It's all connected. Now, I want to address something you might be feeling right now. Maybe you're watching this and thinking, this is a lot. Maybe you're feeling overwhelmed. Maybe you're wondering if you missed the window to plan properly. You didn't. Whatever age you are, whatever your situation, there's still time to make smarter decisions. Even if you're already in your gap years right now, you can adjust, you can shift your income, you can review your plan, you can make changes, stop measuring yourself against everyone else. Start focusing on what truly gives you freedom. And freedom in retirement often has less to do with your bank balance and more to do with your ability to breathe easy on Tuesday afternoons. The real question isn't how much do I need to cover healthcare. The real question is how do I structure my life so healthcare doesn't run my life. Those are two very different questions, and they lead to very different answers. Because when you focus on how much, you chase numbers. You always feel behind. But when you focus on structure, you build systems, and systems create peace. Let me share one more scenario before we wrap this up. I know a couple, let's call them Michael and David, brothers who retired within a year of each other. Both around 63. Both walked away from full-time work. Michael assumed he'd figure out healthcare later. He took Social Security immediately. He didn't look at the marketplace. He just bought the first private plan he saw. Within 18 months, he'd burned through nearly $40,000 in healthcare-related costs. David spent 2 months researching before he retired. He mapped out his gap years, structured his income to qualify for marketplace subsidies, and delayed Social Security by 3 years. His healthcare cost him about $9,000 total over the same 18-month period. Same family, same starting point. Vastly different outcomes. Not because David was smarter, because David paused long enough to plan. If this is resonating with you so far, I'd love for you to subscribe. I make videos like this one on a regular basis. Now, let's talk briefly about something that trips up a lot of people. Health savings accounts, or HSAs. If you have one or had one, this matters. An HSA is one of the most powerful tools in retirement planning, especially for healthcare. Money goes in tax-free, grows tax-free, comes out tax-free for qualified medical expenses. That's a triple benefit almost no other account offers. If you have an HSA and you've been contributing to it while working, you now have a dedicated pot of money specifically designed for healthcare. During your gap years, you can use it for premiums under certain conditions, deductibles, prescriptions, dental, vision, all of it. Even better, once you hit 65, you can use HSA funds for Medicare premiums. So it doesn't disappear, it just shifts purpose. It's a tool that follows you across the entire retirement healthcare journey. If you don't have one and you're still working, even part-time, it's worth exploring. The tax benefits alone can add up to thousands of dollars over just a few years. Retirement isn't about how much you've accumulated. It's about whether your income can support your life. and your healthcare is part of your life. You can't separate one from the other. Now, before we close, I want to touch on one final concept, the emotional weight of all this. Because we've talked a lot about numbers, strategies, subsidies, and accounts. But healthcare and retirement isn't just a math problem. It's an emotional one too. There's something uniquely stressful about not knowing if you'll be covered, about wondering if a single hospital visit could set you back years, about watching parents or friends go through medical crises and thinking, could that be me next? That stress is real, and it doesn't go away because you have a big portfolio. In fact, it often gets worse because bigger portfolios mean bigger fears of losing it. The only real antidote to that stress is preparation, not perfection. Preparation. Because when you've done the work, when you've mapped your gap years, when you've quoted the marketplace, when you've calculated your subsidies, when you've built even a small bridge fund, something quiet happens inside you. The fear starts to fade, the what-ifs get quieter, the unknowns become knowns, and you start living your retirement instead of just protecting it. Retirement isn't the end of something. It's the beginning of something new, a new rhythm, a new pace, a new way of living. And the goal isn't just to survive it. The goal is to enjoy it, to wake up without financial stress, to make decisions without fear, to live with confidence, not hesitation. Healthcare is one piece of that picture. A big piece, yes, but just a piece. And when you handle it with clarity, when you plan for it with honesty, it stops being the thing that keeps you up at night. It becomes just another line item, another handled piece, another quiet victory. You've spent decades earning your retirement. You've worked, saved, sacrificed, adapted. You've done the hard part. Now the goal is to make sure the small remaining pieces, like healthcare, don't undo the work you've already done. So take the time, do the math, get the quotes, have the conversations, build the bridge. Because on the other side of that bridge is a version of retirement most people never get to experience. One where you're not just surviving, but truly living. And that version of retirement isn't reserved for the wealthiest. It's reserved for the most prepared, for the ones who did the quiet work while everyone else was hoping things would work out. You can be that person. You already are in a lot of ways, just by being here, listening, learning, thinking about all of this before it becomes a crisis. That's already a huge step. That already puts you ahead of most people your age. If this video helped you see your retirement in a new way, hit that subscribe button. I've got a lot more where this came from. Take care of yourself. Take care of your plan, and I'll see you in the next one.